Welcome to another episode of New Normal. I'm your host, Cynthia Hutchison, Vice President of Automation Alley, and I am pleased to be joined this morning by the CEO of MedNetOne, Ewa Matuszewski. Good morning, Ewa. Welcome.
Good morning. Thank you for inviting me.
Thank you for being here. MedNetOne is a healthcare management organization that has developed a comprehensive back-to-work playbook to guide small businesses through the return-to-work process. Before I start asking Ewa questions, I'll tell you, we were just chatting a little bit before we came on air about some of the creativity that this COVID situation brought about for many of us, opportunities to look at things a little differently and to maybe try some of those things that we've long thought of trying, but we hadn't mandated because they didn't appear to be critical. So timing has changed, and now the creativity is winning. So Ewa, when Governor Whitmer laid out her expectations and guidelines for businesses to safely reopen, one thing she made clear was all companies needed some kind of COVID-19 playbook. Talk to me about what MedNetOne created, why it's so important for companies to have a document like this available to their staff.
So first of all, I think it's really important that one planned for a pandemic. So all of us were really caught off guard because we didn't know what the next steps might be or how we might be able to help physician practices because they are small businesses, and many people don't look at physicians' offices as being small businesses. So as we began drafting the toolkit, we realized that we wanted to find something that we could base it on. And we discovered that the CDC actually had a one-year developmental playbook that they put on the table in 2009, but nobody knew that it really existed. So we pulled that off and began sifting through the stages that one needed to go through, but we did not have 12 months to develop a playbook. We actually gave ourselves a deadline of 2 weeks and found out that Ford Motor Company had gone ahead and developed a very fine and a very aggressive toolkit, as did Lear Corporation. So we reached out to Ford Motor Company and asked if we could take their playbook and adapt it to what we needed in our community. And we were given permission to do that. So within that 2-week period of time, we were able to scale it down and bring it down to the level of a physician's practice. And we were also able to develop a video, a professionally done video that reinforced the learning in that playbook. And then the governor mandated a way in which we could track the knowledge that our employees or the physicians or anyone had. So we also developed a questionnaire. At the end, if you pass the test, you were given a certificate of completion that could be put into the HR folder. So there were many steps that we took in a period of 2 weeks.
I took notes on that. I don't always do that. That's fascinating. So before we go further down about the playbook, I want to go back to, can you talk a little bit about what Medical Network One is for those who don't know your organization?
Sure. So we're about 39 years old. We are an organization comprised of independent, self-employed physicians. These are the little microsystems, as I call them, that are not employed by the Beaumonts or the McLarens or the St. Johns of the world. These are the small practices that open up every Monday morning, and we support them. We, as an organization, help them install their electronic health records. We help them with maintaining their quality scores, which is so important in an environment that the payers have really been looking at for a number of years, and also the employers. And we currently are at about 900 healthcare professionals, not just physicians, but we also have behavioral health specialists, psychologists. Very important, especially in this day and age with the thought of PTSD as a result of COVID being on our shelf right now. And then we also bring in other specialties. So about 1,000, between 900 and 1,000, depending on who's retiring and who might be moving on.
Wonderful. Thank you. I just wanted to make sure that we understood a little bit about that background that you have, because it's a unique background. So I know that there are, you alluded, there are a lot of playbooks, and there is, I want to get back to your unique playbook. There's so many choices for people to make. And I know we've looked at those here at Automation Alley. Every week I talk to somebody like you, and then I come back with new ideas and I research it and send it to somebody on the team. But what makes this different or is yours is different? Some are hundreds of pages long. Yours is shorter. It's aligned. Tell me a little bit about what makes it unique and how we can prioritize using something handy.
What we did is we scaled it down because we felt that it's not possible for a small business to read through a 200-page manual. So we extracted what would be most crucial for a medical practice, the small business, to open their doors. What did they need to do to make sure that they were safe, to make sure the patients or the clients or the consumer was safe? What needed to be implemented? How were we going to go ahead and pull in PPE, that personal protection equipment? How are we going to stress the fact that inventory needed to be in place so that 60 days from now, they weren't scurrying trying to locate equipment? So we actually created a toolkit or a playbook that was very small, very factual, very to the point, and we are able to update it as we find that there are changes being made by the CDC or other organizations. So the book itself is short, but the important part is also the video that actually complements the book. You're able to view an 11-minute video that gives you everything you need to know about handling cash. What do you do when somebody wants to pay you in dollar bills and in coins? What do you do if you've got a vending machine in your waiting room? What are you supposed to do with the magazines and everything that you used to have there? So the video actually complements the toolkit. And then we also developed a checklist. So you know exactly what it is that you need to have in place. And the final page of that checklist, especially in a physician's practice, the doctor has to sign that checklist. So everybody is crucially and keenly aware of what needs to be in place. And it's not that you're flying by the seat of your pants, but I, as the business owner, the physician, I take accountability for everything that's happening in that business, that practice.
Fascinating. And one of the things I want to point out, and I just have a personal experience with, and I'm sure a lot of people do, is we're talking about medical practices. That a medical practice is a small business. A small business is a medical practice. I had two friends start small businesses the same day. One was a sports medicine specialist. The other was a telecom consultant. They had the exact same concerns going in. Well, I get clients, how will I get clients? How many clients am I going to get? Will I make enough revenue? They had the exact same issues 2 months later. I have plenty of clients, but how do I get them to pay me? That, they were I watched this parallel universe of how two totally disparate businesses, they were both small businesses trying to figure out how to move forward. So I want to make sure people watching understand that this is applicable across any business. So you already talked about how you update it. So you're updating regularly, and it's obviously electronic, and therefore everybody has an updated version. Just an audit. Is there a download?
Yes.
The playbook updated?
Yes, it's on our website. It's on www.mednetone.net, and you can go ahead and actually update it, and you can download it as often as you need to. So everything that we've developed, whether it's the video, there is no cost to any of the tools. Everything that we have is available to small business, to large business. And that's because we have a firm commitment to making sure that the information that's being pushed out is accurate, and that what the governor has mandated, because some folks think this is a business decision. It's a business decision, but it's also a mandate. It's the law. The governor said you have to do this. And initially it would have ruffled some feathers. We don't want to do it. We had no choice, because we have to make sure that patients are safe. We have to make sure everyone that comes into that small business knows that we've cleaned, we've sanitized. So we also developed a poster that you can print out with your company logo. And we've had those hanging in practices and businesses. And it basically says, we've gone ahead and cleaned and sanitized. And if a person says, well, tell me a little bit about your sanitation process, or your sanitization process, I should say. So most folks now know we've cleaned the air ducts. If you own a building, and if you've not gone through the process of installing new filtration systems, or you've not cleaned out your filtration system, your air ducts, that's got to be done, because all your recycling is what used to be there prior to COVID and during COVID. So all of that is in that playbook. Every single step, upload it, download it. You can go ahead and use it as need be.
When this is over, when we send out a follow-up email with this, and for everybody who's watching, I want to make sure you know, I will also include your video, right?
Great.
I want to make
Yes.
sure that people get to see the video. I want to see the video.
Yeah, and let me say something about the video. What was really unique is when you're dealing with a professional organization, because this was done by a professional company, you usually get a script and you wait weeks. Bureau Detroit did this in one day. So to be able to film from 8 o'clock in the morning until 8 o'clock at night, get everything in, and then make sure that it's edited and push it out in a very specific time frame, they did a marvelous job. And I have to compliment them on it, because I never expected an organization to be that agile and that equipped to meet our needs.
That's really wonderful. Now, that is good to know, because we have the exact same issue, again, with a lot of things. When you want to do a video, particularly right now, people want to do things now. Everything we're doing now needs to be done quickly. When we talk about things that haven't been done before, or things that we've been suddenly accelerated on, that's sort of the germination of this series. Was all of a sudden, we've been talking advanced manufacturing for years here, and our CEO is, as like the pulpit on Industry 4.0. He's really a great evangelist. Tom's got great vision and great ideas, but as much as we evangelize, some companies it wasn't their priority. Again, we work with the small companies. A small to mid-sized manufacturing company doesn't want to stop everything and go install sensors. They don't want to stop everything and do these certain steps. And I understand it, because they've got orders coming in. That's how they make money. They have to stay in business. This forced shutdown with a mandate to do X, Y, and Z before you reopen, that came from the governor, had everybody who I've called inertia has been our enemy. I mean, we've been sitting back waiting for people to work their way through their own little bout of inertia, which we all have. My apartment was always clean during finals week, in college, because I was avoiding studying. So I decided to clean under the bed. Those are the things we do. But when you look back at that, this forced new way of thinking has become, all of a sudden, we've got layers and layers of technology in small manufacturing that wasn't there before. You've got layers and layers of technology in medical systems that weren't there before. So it's really a fascinating outcome of this time of our lives, that we've had to step back and use that creativity that makes us, and we're talking again about the rugged individualism of America, and one of the big pros to that would be creativity. So I think you're the first person I've talked with who's talked about generating an actual certificate for the completing the quiz, which I really like. I think that's an important thing for HR people to know, that everybody in the company knows what they're expected to do.
And it also includes senior leadership, anybody from top down. So when we started this process, I actually had physicians saying, "Oh, yes, my staff took the test." And I said, "And you, doctor?" So everybody top down. And the other thing that I would just like to mention is communication was the key to the success of reopening many practices and many organizations. And that communication started before the doors would open, to allay the fears of people coming back. And then what we recommended was allowing staff to come in at straddle times, just to see the new in the organization or the practices, so they themselves could see, "Oh, you've got shields up. Oh, I see that we've got cleaning supplies. My desk has been, oh, this is really great." So that communication had to have the human touch, because we're still dealing with anxiety and fear about coming to the old place as opposed to the new place.
Thank you. So what are some of the recommendations in the playbook that you think are most critical?
So number one is communication, without a doubt. Let your staff know what you've changed and what is expected of them. It was really difficult for most practices to redesign their employees' workflow, or the way in which they entered the building. One place to come through, another door to exit. Taking that little mini test every day to make sure that the symptoms had been addressed. And if a person did say, "Yes, I was ill, I wasn't feeling well yesterday," an officer of the week would go ahead and say, "You know what, why don't you go back home?" Someone to take the temperature of people coming through. And this is just the new norm, to make sure that there is safety. That's the top area. The next thing is making sure that each desk or each area does have sufficient equipment to sanitize. You want to make sure that you've got hand wipes, so that if there are door handles, there are hand wipes placed strategically. I have to thank the Oakland County Chief Executive for creating those little toolkits for practices and for organizations. You got a gallon of sanitizer, you had gloves, exactly what was needed just to go ahead and start the process of reopening your organization, your small business, your practice, and just making sure that there is somebody who's responsible and accountable for day-to-day activities. Everybody's leaving, who's going to wipe down the tables, who's going to go ahead and check to make sure that the policies, that checklist has been followed through at the end of the day, and then making sure that somebody signs off on it at the beginning of the day. And it can't just be one person. If that person's not there, you have to have somebody to step in to help out. So it's communication, training, education, making sure that you've got sufficient PPE, and locking that PPE down and not using it as your current inventory, making sure you've got a 30-day or even a 60-day supply. So a lot of retooling.
Very interesting. I'm thinking through all the things that I've seen in different places already. So I know you've got 900 companies in your network. They're using it. Are people using this locally, nationally? How do you know how your playbook is being utilized today?
So we've received requests from the American Osteopathic Association, which is a very large, I would say even international organization because of the number of physicians they have in other countries. So they've asked for permission. We've gone ahead and provided it to 39 local physician organizations similar to Medical Network One. Blue Cross has gone ahead and endorsed the book. And so it's been made available through their channels as well. And we've gone ahead and made it available here through the Michigan Osteopathic Association. And we're not holding anything back. There is no cost. You call us, you take a look at our website, it's there to be used. And one of the crucial things that we've seen this book has done is it's really opened up your eyes about what are we going to do tomorrow. The playbook is, yes, it's for what we should be doing now, but it also addresses the issue of what happens in November and December when the next wave might hit. And realistically speaking, it's not just a pandemic that's viral or bacterial. What we've designed will also work if there is a basic human emergency, or if you're looking at an earthquake, if you're looking at a tornado, or some type of a situation that requires this type of attention. So even though it's called a playbook, a COVID playbook, it applies to very many situations.
And I think that's one of the things we're finding with this experience we're all going through is that we're looking at, we need to look today through the lens of COVID because that's the enemy of the day. And it will be for some time, but there is a flexibility and an agility that we're learning through this that we are hoping we can utilize long into the future, technological advances that will take us in the future. And you do need to have a resource that overlays beyond COVID into these human crises, because I'm sure we will have more. This once in a lifetime thing we're living through now doesn't mean it's the only bad thing we're going to face. It just happens to be the one we're in right now, and it is epically unique.
And so I'm sorry, I just wanted to add one thing because you asked about the playbook. So the playbook has been translated into a few languages overseas because we received a request from a few organizations overseas asking if we could go ahead and translate it. And we said, we don't have the capability of doing all the languages that you're looking for. So it is available in certain areas overseas as well. And if anyone is looking for it to be translated for a specific reason, then absolutely, there are already translations of that toolbook.
That's nice. I will tell you, in my past life, and I was involved with nonprofit work, and I had put together, I had my website. I could not afford in my little nonprofit to translate, and yet I had a demand for my product in German, particularly in Spanish. And I used my local high school National Honor Society students and extra credit for translating. And then their teacher wanted to represent how well they were trained, or how well they were educated. So the teacher would usually volunteer some recap time to do a final edit. So it's kind of an interesting resource sort of for low budget.
No, that's fabulous. That's a great idea. Thank you.
Yeah, I'm all about finding those corners, So I know that this has been geared for small business. Can you talk to me about applying it to large businesses? Where else does it go?
So it fits into every walk of life, basically. If you take a look at the toolbook or the playbook, you can even apply almost everything in it to your own home, because you want to make sure that you've got those tools that we keep talking about, the hand sanitizer. And if you don't have it, how can you make it? You don't have to purchase items. Much of what we have in the toolbook or the playbook is something that you can create on your own, which was the other thing that we wanted to focus in on as we developed it. So this book and the stages in it applies from a 2 or 3 employee organization all the way up to 1,000 employee or even more. It's the basics, without the fluff, without the additional information that one would consider to be background noise. It's just the meat, which is what we've discovered in healthcare works the best, because people do not have time to spend hours, number one, researching, creating, but then sifting through the information just to extract what's important. And the crucial part of that playbook, again, is that checklist, because it is a 5-page checklist, so you can assess the readiness of your practice. And as you complete that checklist, we have a stoplight that is created. So if it's red, it means you don't have anything in place that needs to be in place. If it's yellow, that means, move with caution, as with when you're driving and you see a stoplight. But then if it's green, that means full speed ahead and maintain it. And we routinely remind our organizations, you should be taking a look at that at least every 90 days to make sure that nothing has fallen below the waterline.
Interesting. Yeah. One of the things I do is I try not to look through these things ahead of time. So after this, I can't wait. I've got a gap this afternoon. I'm going to go ahead and start this for our organization. I hope if my CEO is watching, he takes a look at it right now, because it's an exciting thing to realize that even we who have, we're coming back in little bits in small cohorts right now, have a lot of things in place, and we've got a very detailed checklist. But I don't know, I'd like to look through somebody else's lens. That's one of the things I've enjoyed, is getting a chance to see it through multiple lenses. So what do we need to do? I'm going to talk a little broader about COVID. What do you think we can do at the local level to help, prevent the spread of COVID? What do we all in our businesses and our daily lives need to do differently?
So the one point that we stress and we really reinforce is wearing masks. And that's for your own protection, actually. So if anything, we have invested thousands, if not hundreds of thousands of dollars for our physicians, for that 1,000 group, to make sure that they have what they need. So if anything, make sure you have that. Make sure you have soap. It's amazing how difficult it was to find liquid soap. But you know what? We grew up with bar soap. There was no difficulty finding bar soap. You would go to a Meijer's, you would go to a Kroger's, and there was bar soap, but there was no liquid soap. So think like we did maybe 20 years ago, where there wasn't all the liquid soap, and then realize that you do need to have not a plethora of things. You don't need a massive amount stored, but make sure you do have some bleach at home, just the standard things that you might need. And as you prepare for the next wave, make sure you've got some gloves at home, because you never know when you might need that. And I'll have to just mention this. So as we got into month 2 of the pandemic and the testing sites were popping up and people were able to receive their tests, we were receiving real-time feeds of the lab results. So imagine an organization like ours that has all of these practices being able to reach out to patients saying, you know what, we see through this feed, because we have permission to do this, that you have tested positive. What can we do to help you through this 14-day quarantine period? And we would package supplies, not only for those that tested positive, but for everyone in the household. And it was really amazing because we also have what we call care managers, the discussion about the education that needed to go along with that, the flow sheet. If you're at home and you're self-quarantined, make sure you've got a pulse oximeter, make sure you've got a thermometer. Amazing how many people didn't have thermometers. We had to buy just crates of thermometers to send out. So just having some of the basic things at home and recognizing signs and symptoms and not doing anything such as gathering without a mask with groups of 20, 30 people. We are always concerned as we see young people, graduation, getting together in their parents' backyard, having parties, and then our fear is 5 days, 6 days later, we're going to read about that party. Nonsense. Make sure and follow exactly what we're hearing these days. But mask is probably the number one thing that we would stress.
Thank you. And I like the outreach package you have, because that is a thing. I think people test positive, and I hadn't thought about it, but I suppose if I tested positive, I would want to stop at the grocery store on the way home and make sure I had all the things I needed to protect me, but you can't.
No, and that's why we did this when we created what we called an internal task force of our clinical teams, and it became so obvious. You come home, I'm your spouse, right? And I'm worried about you because Al, you've got the symptoms, you're tested positive, but then what about me? And so what we also discovered is there were spouses that didn't recognize the symptoms until after our teams had spoken to them. So the cough, the fever, the diarrhea wasn't that they just had a little virus. They actually, had to be tested. So there was a lot that we did to maintain the integrity and the knowledge that needed to go along with the tools that we supplied. And my fear factor now is if you are in an organization that does not have a behavioral health segment, please make sure that there are telephone numbers, that there is access to an organization that can support your needs. And one of the biggest groups that we've been working with is the Judson Center, because they have such a large net, a large spider web, I would say, of reach in the community. And we know that they're ready to take in patients, take in clients that might have a high level of anxiety, depression, fear. And they even have a primary care clinic there that works with them on a lot of these areas. So whatever you do, make sure you have your ducks in order.
Thank you. Now, we know schools are going to be starting soon or not. Something's going to be happening. Education is going to begin ramping up for our elementary school and high school students again. How does all of this apply to them? There's such a wild card there about density. And again, you and I talked about this before we started, the population density of a classroom. How does this help them? Maybe the same playbook.
It is the same playbook because we used the playbook when we recreated and redesigned our own office. We were the ultimate test site. In our building is a physician's practice. We went ahead and did the same thing there to see what we should or shouldn't do. And we tested it. We didn't push it out until we tested it to make sure that it would meet the needs of the consumer or the small business. This playbook actually holds water in a school as well. And earlier I had mentioned my cousin who's in Poland has a very large international baccalaureate school. And exactly that playbook is what he is following to make sure that he has enough acrylic shields. He has the sanitation products in area. He makes sure that he was able to mark off the stalls in the school's bathroom area. So everything that we have in that playbook applies for 1 and 2 people, and it applies for more than 1,000. And schools really need to start thinking about installing shields and how to keep the students safe, how to keep the faculty safe. And that playbook really gives you some great tips to do that.
Wonderful. Do I dare ask you about immunization? What are your thoughts on immunization? You want
to? Henry Ford is doing the testing right now, and they, and not just they, but any group that is testing, we are eagerly awaiting the results of the test. What I would recommend highly for those folks that are fearful of the routine flu vaccine, do not shy away from getting that flu vaccine. We at our organization, since we are a healthcare organization, we mandate immunizations. And I hate to say this, but it's one of those things where you're dealing with people and you don't want to go ahead and spread whatever it is that you might have. So we are firm proponents of immunizations when the time comes and a COVID vaccine is available. We will wholeheartedly endorse that, and we're hopeful that it will be at the beginning of next year, if not earlier than that. But we will wait to see what Henry Ford and what the CDC and others give us as far as direction is concerned.
Thank you. No, Ewa, I want to thank you so much for your time today. It's been quite informative for me. And for companies who want to learn more about the playbook, how do they get in touch with you? I'll send an email to them as well, but how do people get directly in touch with you?
So they actually can call Medical Network One. That number is 248-475-4701. And we are in Oakland County. We're on the corner of Silver Bell and Adams, for those of you that are familiar with the Rochester area. We've been here for many years, but if you send the link out, feel free to do that. And then anyone who wants to download any of the tools, they're there. And feel free to move it from an Adobe into a Word document if you choose, modified. If you do that, just give us credit at the end of the book indicating that it is a reflection of what was provided to you by Medical Network One and Practice Transformation Institute, because they are the training and education arm.
Thank you. Thank you very much. Have a wonderful day. And thanks again for your time, Ewa.
My pleasure. Thank you so much.